I hope we're not having the same conversation in a decade's time. Um, this was a really wide-ranging, thorough report, and it was sadly unsurprising to many of people who work in the sector, because these are long-standing issues that haven't really been addressed adequately. And the crux of it is that we are essentially we end up criminalizing people for essentially what should be seen as a public health issue when it comes to mental health. And it's the fact that it's at every single stage of the system, as was examined by this report, from police to courts to custody to probation to prison to resettlement. It cuts across all of the entirety of the system. There are pockets of good practice across the country, which obviously is always heartening to know about, and lots of the members of Revolving Doors do get really good support. Many get very inadequate support and far too late. I think, though, on this issue, I'm going to sort of slightly, I'm going to try and put my optimistic hat on, in the sense that I think that now there's a real opportunity. We are talking about mental health, about trauma, about PTSD within a sort of post-COVID context in a way that we've never spoken about before in society. And the government are talking about their commitments to ensure that mental health provision is adequately funded and that people get support at the right time. And it feels to me that if this could be seen as part of the sort of like the great reset around, coming out of COVID, given the fact that, mental health touches people, and I mean, it touches people across all sections of society. And particularly if you look at people within the prison population, particularly those on short sentences, the vast majority of people who are in there have got mental health, substance misuse problems. And what we fail to do within our system is to really tackle the root causes of offending behaviour. And instead we end up criminalising and putting people through a system which does nothing other than exacerbate their existing problems. So there are obviously lots of commitments from across different agencies to do better, and the recommendations across this report need to be taken up. But I'm hoping that as we look at mental health through a new lens, given what we've been through as a country, as well as a global population, that we can then have an acute focus on those people who are more vulnerable to mental health issues, and how those get addressed before people enter needlessly, for a lot of these people, enter the criminal justice system.